everyone. Hope you're all doing well. We are now going to talk a little bit about prenatal care. We talked a little bit about fetal and placental development and how important preconception and prenatal care is for optimal outcomes. And this is kind of just a continuation on that because we're always thinking of what we can do to promote good outcomes. Preconception counseling is when somebody is thinking of getting pregnant and they talk to a doctor about anything maybe that they need to do to be prepared to get pregnant. For instance, a lot of people are on anti-anxiety medications or depression medication, and it's good that they talk to a doctor to see if those medications are safe for pregnancy. In addition, we already discussed how important it is for diabetics to have some preconception counseling on establishing good A1C levels before getting pregnant, at least 3 months of good ones, 5 to 6.5%, and those types of incidences. So it's good to go into a pregnancy healthy. We're talking about already being maybe on folic acid, eating good, having a good weight, good blood pressure. Do as much as we can to go into the pregnancy as healthy as possible. And that actually promotes better outcomes. So for preconception counseling, maybe you'll have a medical checkup. It's good to know your family history and risks so that we know what to look out for when they are actually pregnant. Make some behavioral choices regarding alcohol, tobacco, and illegal drugs. Those should be out of the picture. And we can say an ideal body weight. And that one is a little bit tough, but as best as you can, I'll tell patients to get to an ideal body weight, particularly healthy food choices, which includes a nutritious and balanced diet. And of course, we suggest already going on folic acid to prevent neural tube defects. We know that maternal and fetal risks are increased when the mother is either slightly underweight or overweight. So we encourage women to be at a desirable body weight before conception, if at all possible. Now, that's preconception. Prenatal care should begin after the first missed period, so once they are pregnant, they should make an appointment. I will say that some patients report having trouble making that first appointment because by the time they figure out they're pregnant, figure out their insurance or lack of insurance, and then finally find a doctor, a lot of times they don't get in until later in their pregnancy. But it's important to get in as soon as they can after their first missed period so that we can monitor the growth and the development of the fetus. We can treat any pre-existing conditions and those that develop with pregnancy, particularly STIs, UTIs, and other conditions such as that, identifying the abnormalities, and also to seek support and learn parenting skills and to educate them on all the resources that we have available for them, including nutrition classes, childbirth education classes, breastfeeding classes, parenting classes, baby care classes. There's a variety of support systems out there for them. Many books speak of an adaptation to pregnancy, and basically it's talking about just about establishing a relationship with the fetus, and they say it unfolds in 3 phases. The first one is actually accepting the fact of pregnancy. A lot of people say, oh, I missed my period. Oh, I can't be pregnant. Then they go out and they get a pregnancy test at the dollar store, and they're like, oh my gosh, I might be pregnant. No, I can't be. It's because it's a dollar store one. Then they go get another one. By the time they actually accept the fact that they're pregnant, then they go in to see the doctor. But there's always that disbelief, like this can be, because you don't, because you can't believe that you're actually pregnant. Once you accept that there is that you are pregnant, it's another thing to accept there's actually a growing fetus distinct from herself as a person to nurture. And a lot of time this occurs as the baby gets big enough for the mom to kick, and then they realize, oh my gosh, this is a total person. Or when they see it on ultrasound, they get that realization, not only the fact that they're pregnant, but they actually have this being growing inside them. And the third phase they talk about is actually when they get excited and they start preparing for the birth and preparing for the fact that they're going to be parents. How do I breastfeed? How do I change a baby? What's the right temperature to keep the house at? All that is in preparation for the baby. So we notice that a lot of parents go through this adaptation pregnancy. In preparing for childbirth, There's the ability for paternal adaptation. I mean, both mom and dad have to get to the fact, oh my gosh, we're going to have another baby. And if you have children already, the siblings need to adapt to that as well. Siblings sometimes have a hard time because they want everything to be about them. And grandparents go through their own adaptation as well. Sometimes grandparents are eager and excited to be grandparents. Some of them are a little overbearing, and some of them really don't want to be involved as much. So there's adaptations for everybody when there's going to be a baby. There's both childbirth and perinatal class educations. A lot of people think that we just give childbirth education classes, but it's not true. We do a lot of classes to assist individuals and families to make good decisions. And like I said, those include breastfeeding classes, baby care classes, sibling adaptation, all kinds of classes. But childbirth education classes really is to empower experience, and all the classes together are all about health promotion. We talked a little bit about some of these slides when we first came into the class, because some of the stuff that we needed to know, like perinatal care choices, we talked about how there's physicians, nurse midwives, direct entry midwives, and independent midwives, and doulas. So if you have any questions on those, let me know. But if you refer back to one of our first lectures, we talked about the perinatal care choices as well. There's a lot of things that we can do to influence the outcome of our pregnancy. And maternal nutrition is one of the many factors that can influence the outcome of the pregnancy in a positive way, hopefully, not a negative way. The importance of good nutrition is emphasized for reasons that it decreases the amount of low birth weight and also preterm rate. So preterm birth rate. So we really emphasize the importance of good maternal nutrition to feed the baby. A lot of women want to know, well, what's the right amount of weight gain? How much weight do I get to gain? And it varies among women. When we think about how much a patient should gain during her pregnancy, it's important to look at her pre-pregnancy weight for her height. And the thing is if she's a little underweight, we're probably going to want her to gain a little bit more weight during her pregnancy. If she's right on target, we'll probably have her gain the average amount. And if she's a little overweight, she may gain a little bit less. So here we have normal weight at conception. The estimated good weight to gain would be about 25 to 35 pounds. If they're a little bit underweight at conception, we may encourage 28 to 40 pounds. If they're overweight at conception, sometimes that's 15 to 25 pounds. I once had a lady that even actually she was overweight at conception, and she gained less than 10 pounds. And they weren't concerned because once she got pregnant, she was so excited. She ate only good foods, and she gave up cookies and cakes and pastries and Coke products. And she actually was nutrient-dense, good food, and she was actually feeding herself healthy. But because of that, she was also losing some of the fat that she gained. So they were more concerned about the nutrition, but she actually lost a few pounds during her pregnancy. We already talked about how we look at the BMI, and we know that 18.5 to 24.9 is the normal. Anything less than that is a little bit underweight. Anything over that is considered a little bit overweight. When we talk about weight gain, we want a progressive weight gain throughout the pregnancy to ensure normal fetal growth and development. We don't want them to gain all their weight in the first trimester or all in the last trimester. It's really just progression. When the patient gains weight, it promotes disposition of maternal stores for successful lactation. We live in a fat phobia society where women are afraid of gaining weight. What we really need to let them know is that it's normal to put on a little bit of extra stores when a woman is pregnant. They do it as reserves, particularly for lactation. But we do want that weight gain to be achieved by a balanced diet. It's nothing to do if a weight gain is achieved through potato chips and Coke and cookies, but we want it to be a well-balanced diet. So what they eat to gain the weight is important, and the pattern of weight gain is also important. Most of us have taken nutrition courses, or we kind of know what adequate nutrition is. I think every pregnant woman should have this on the refrigerator to remind them that what they eat, they are giving to their baby. So here we look at a woman with normal weight gain in pregnancy. Um, so her breast increase will take about 1 to 3 pounds. The blood increase is up to 5 pounds. Maternal stores, that's the extra fat, is 4 to 8 pounds, and that's normal. And so women are so afraid of it, but it is normal in pregnancy. Those stores are important for reserves. The placenta can weigh up to 2 pounds. The amniotic fluid is 2 to 3 pounds. The fetus is anywhere from 7.5 to 8 pounds. And we know sometimes it's bigger and sometimes it's less. And the uterus increase is about 2.5 pounds. So that's the average of 24 to 28 pounds right there. We all kind of know what good nutrition is. Not, here's a reminder. When a person eats good, they feel good. Okay, they have a feeling of well-being. They also have more energy, and they also increases their chances of a healthy baby. So nutrition is important. When a woman is pregnant, her protein demands increase because protein are the building blocks and they're building a baby. So protein is essential for them to get enough protein in their pregnancy. What we're finding is a lot of people just don't drink enough water. Fluids, we want about 8 to 10 glasses of water a day, and most women do not drink that. And it's really important in Arizona for them to drink plenty of water. We want them to have the correct minerals and vitamins, and most of them will be put on a prenatal vitamin to ensure that, with plenty of folic acid as well. Now, some people will say, well, caffeine, do I have to give up my coffee, my foo-foo coffee? I love my coffee. And evidence is far from conclusive, but the March of Dimes recommends a daily intake of more than 200 milligrams. Now, if you told a patient that, they wouldn't really know, what does that mean, 200 milligrams? There's approximately 900 milligrams in a small cup of coffee, so therefore maybe 1 to 2 cups a day. But they have to remember that there's other foods that have caffeine in them, like chocolate and other things. But they just recommend no more than 200 milligrams. Artificial sweeteners. People say, can I have artificial sweeteners, whether it's in, my drinks or whatever? And there are a lot of foods. And interesting enough, a lot of people will stay away from artificial sweeteners. There's a lot of evidence to think that it's not good for you. But actually, artificial sweeteners are approved by the FDA. So therefore, it's really up to the patient what they choose to do. A lot of them will stay away from the artificial sweeteners, but it's interesting that the FDA does say that it's safe. Vegetarian diets. We have a lot of vegans. When vegans are a little bit different from vegetarians, because the vegetarians, some of them will still eat some foods from animal origin, but strict vegetarians or vegans consume plant products, and those are the ones that we're most concerned of because B12 is found only in foods of animal origin. So a lot of times we just want to make sure they're getting the right amount of B12, but if we look around in our grocery stores, most of our foods are fortified with vitamin B12. We want to make sure that if anybody's eating eggs, that they're definitely not expired, that they're not raw or undercooked because we fear salmonella. And so we just want to make sure that they're not eating cake batter with raw eggs and those types of things. Also, there's the concern of mercury. So mercury is in large fish like fish tuna, yellowtail, shark, mackerel. There's a lot of fish that have high amounts of mercury. And so there's different research and evidence on how much is too much. So we just tell them to limit the amount of high mercury fish that they're taking. With women, we're always concerned with infection. And listeria can easily be passed to the fetus and cause some bad stuff. And listeria we can find in unpasteurized milk. And people loved soft ripened cheeses like brie cheese and some of the other soft cheeses. And what we have to remember in blue cheese is that there is a chance of unpasteurized, that because they use unpasteurized milk, there's a chance of listeria. But most of the time, the science tells us that if the food is properly handled and stored, the risk of being infected appears to be very low, like blue cheese and brie cheese. So basically, the recommendation is to consume in moderation and obtain from reputable stores. Anything unpasteurized, though, you think of listeria. We know that a lot of patients they have anemia during their pregnancy. And so we start out the pregnancy by telling them how important iron-rich foods are, particularly green leafy vegetables. Because if they do become anemic later on, then we will put them on iron pills. And patients aren't very compliant with them because they sometimes causes their stomach to be upset or dark stools, so a lot of them aren't compliant with that. So it's best to start them off with knowing the importance of iron and which foods have a lot of iron in them, particularly the dark green leafy vegetables. We also know that vitamin C helps with absorption, so it's important to get plenty of vitamin C as well. Calcium is important, and calcium-rich foods includes yogurt and cheeses and milk. And actually, one of our new superfoods is sardines. Sardines are rich in protein and calcium. As long as they don't have too much sodium in them, they're actually a very good source of calcium. As much as we worry about those that have excessive weight gain, we're also worried about those with inadequate weight gain. We do live in a society that's obsessed with fitness. And we let them know it's really important for us to let females know that a little bit of extra weight is okay, but not too much. But I mean, you've got to put on some fat stores for delivery and actually for lactation. And what we stress is that pregnancy is not a time for weight reduction diet. We want them to avoid the empty calorie foods and put an emphasis on nutrient dense foods. But pregnancy definitely is not a time for any kind of weight reduction. On the same hand, we're also concerned about excessive weight gain. A lot of people think that being pregnant is eating for two. Pregnant women is not about eating for two. Pregnancy, I love the way they word this. Pregnancy is not an excuse for uncontrolled dietary indulgence. It's really all about eating good foods, getting the most for your calories, and eating the most nutritious foods that you can that are well balanced. Some women experience pica, and that's when they consume non-food substances, clay, dirt, soil, laundry starch. Interesting enough, it's more common among African American and Hispanic women who are found to have lower hemoglobin levels. And it's interesting, I had a student once that was a male from Africa, and he says, yeah, when they were kids, they could smell the good dirt that they would eat. Yes. So if we do have patients with pica, we would check their hemoglobin levels and try to help them with that and encourage them not to eat non-food substances. Teens have their own nutritional needs. They lack nutritional knowledge. There are educational programs out there, but teens tend to like the fast foods. They tend to like snacky foods like chips and cookies and Cokes. We need to let them know that it's how important nutrition is, and give them that education. There is competition between the growing adolescent and the fetus for the nutrition, because the fetus is growing, but also the adolescent is still growing. So there's a great need for the appropriate amount of protein and other nutritional resources. Exercise. How much is too much exercise in a pregnancy? Well, what they say is that whatever you were doing before should be okay once you're pregnant. So if you were running, that's okay as long as it feels good and that you're making up for the calories and the fluid intake. But moderate exercise during pregnancy has numerous benefits. including good muscle tone, a sense of well-being. They just don't want you to start an extensive exercise program, once you find out your pregnancy. But if you've been doing it before, go ahead and continue it. If you haven't been exercising before, we always suggest starting out with some nice walking and increase your pace. But it is important for those who do exercise a lot is to drink enough fluids, and their calorie intake must be enough to meet the increased demands. Heartburn is a common issue with women when they are pregnant. It's usually caused by the reflux of gastric contents into the esophagus, which causes the burning. This happens more in women, and it could be due to hormones that kind of have more of a sluggish response in the tract. We encourage women with heartburn to eat small, frequent meals and to avoid spicy foods, to sit up eating and avoid lying down, sit up after eating and avoid lying down, and avoid eating gas-producing foods. Constipation is another reported problem because of this sluggish tone in the GI tract. So we encourage them to increase their intake of fiber, drink lots of fluids, and some large physical activities in large muscle groups like walking or bicycle riding can help with constipation as well. Just let you, I think this is in another slide too, but to calculate the date of delivery. Today we use we just put in their first day of their last missed period in on the computers, and it will calculate the due date. We can get a due date from an ultrasound. But what if you don't have any of those resources? I was in Costa Rica with a bunch of nursing students and Nagel's rule, and they were able to calculate the due date by taking the first day of the woman's last menstrual period, subtract fruits from this day at 7 days. For example, the first day of the last menstrual period is June 14th. Subtract 3 months, that's March 14th, and add 7 days, which puts you at March 21st. So if you have any questions, be sure to write them down and be prepared to ask me during class. We may get to this week or next week, next Wednesday. Thank you.